in the country. We also have trained 58 healthcare workers in general postpartum family planning, including orienting them to the updates on the medical eligibility criteria. We have printed and distributed some job aids for postpartum family planning and also some IEC materials which have been used for this training. Next slide, please. So what are some of our current challenges? Coordination of ongoing postpartum family planning activities is a challenge. Different organizations are doing little pilot projects here and there. So we are now working to get the Federal Ministry of Health to take charge of coordinating all of us. The second challenge is the inadequate number of trained healthcare workers to launch a national scale-up plan. We will need to train many more. We have a weak family planning commodity security resulting in some stockouts of family planning commodities at service delivery points. Again, this is due to shortfall in funding for procurement of some of these commodities, which is being addressed by donors and the government. There is also a lack of an integrated data collection tool for postpartum family planning. We do have a national health management information system, but it does not have many indicators that are relevant to postpartum family planning. Next slide, please. So what are some of our future plans? Well, we want to complete the revision of the national family planning materials as discussed earlier. We will thereafter print and disseminate these revised materials and guidelines. We need to mobilize some resources for orienting and training trainers at the national level, state level, and also with different development partners that are working in this area. We would also be training new national postpartum IUD trainers and postpartum implant trainers before stepping down the training to skilled birth attendants. We realize it's very important for us to train skilled birth attendants working in the labor ward on postpartum IUD and postpartum implant insertion, so that they can provide these services before the clients are discharged, rather than referring them to the family planning clinic. Next slide, please. We also, as I mentioned, plan to integrate these postpartum family planning activities on the day of birth. We are improving the quality of care on the day of birth, and we think one of the important ingredients will be to offer postpartum family planning before the patient is discharged. We also consider introducing postpartum family planning through other child welfare programs, so that when women bring their newborns for follow-up in this clinic, they can access suitable postpartum family planning methods. We are also advocating to the Department of Hospital Planning, Research and Statistics to include indicators for postpartum family planning in the national HMIS reporting system, and also providing more job aids and IEC materials in the health facilities where services are being provided. So in all, we are hoping that over the next few months and years, we would be scaling up access to postpartum IUD and postpartum implants as long-lasting reversible contraception for our women that need these services. Next slide, please. So I thank you for your attention.
Thank you very much, Dr. Odolor, and I want to thank you for your tremendous leadership here in Nigeria. And it's exciting just to note that in Nigeria we have a new Minister of Health who is very pro-family planning and very interested in integration and PPFP. And they're having their annual National Family Planning Stakeholders meeting on Thursday and Friday, and I look forward to hearing more about the PPFP at that meeting. So now we're going to turn our attention to the Philippines, and we're very excited to be joined by Dr. Bernabe Maronican. I'm sorry, maybe I'm sure I pronounced your name wrong. So Bernabe, turn it over to you, and if you wouldn't mind introducing yourself, that would be wonderful.
Good evening, everybody. Good morning to some of you. And this is Dr. Bernabe Maronican. I'm a Senior Technical Advisor for Legal Health, Jhpiego in the Philippines. And I'm here to present to you the output of the team from the Philippines that attended the Global Conference on Postpartum Family Planning in Chiang-Mai. First slide, please. Now, on your screen, you can see the postpartum family planning data, country data of the Philippines. For our annual number of births, it's about 2 million a year. Our modern contraceptive prevalence rate is 23.5 for all women of reproductive age, and it's 37.6 for married women of reproductive age. Our fertility birth rate is at 61.1%. The percentage, after the percentage of inter-pregnancy interval, 7 to 17 months inter-pregnancy interval constitutes 10.8%. 18 to 23 months, 40.7%. 24 to 35 months, 25.9%. And 36 to 47 months, 14.6%. Our unmet need is at 17.5%, 10.8% of which is for limiting and 6.7% for spacing. Our percentage of postpartum prospective unmet need is close to half, 47.6%. Our DPT3 vaccination rate is at 86.1. Now, second slide, please. Next slide, please. In the conference, in the Global Conference on Postpartum Family Planning, we came up with our action plan. The three highlights now appears on your screen. The first one is we intended to come up with a Department of Health administrative order on postpartum family planning, which will pave the way for the national implementation of the program. The second highlight is a pilot, integrating family planning into the EPI, or Expanded Program on Immunization. But this is not at the rural health units. This is at the household cluster level. And the third highlight that we intended to do is to harmonize postpartum family planning reporting and or tracking system. Next slide, please. Now, what have we done so far? We have, for activity number one, for highlights, for the number one highlight in the previous slide, we already have a draft administrative order on postpartum family planning, which we are circulating among key people in the Ministry of Health. And we're hoping that the Secretary of Health will sign the approve the administrative order before the election craze actually starts next year. For highlight number two, integration of family planning into the expanded program on immunization, Dr. Dukusin, the Director for the Family Health Office in the Department of Health, has drafted pipeline for FP or family planning, expanded program on immunization integration at the household chapter level, and this guideline will be used to pilot the intervention or the initiative as soon as we find the area where we can pilot the initiative. Right now, the DOH actually is on the organizing. So Dr. Kapusian has no time yet to push this. Now, for activity 3, harmonized postpartum family planning reporting or tracking system, we have started in Visayas. The USAID now tracks postpartum family planning services that they provide in 18 hospitals, and they integrate this data with family planning services in public health facilities. Now, there are two other things that I'd like to tell you that we're very proud of. One is through our advocacy, we are able to get the Philippine Health Insurance Corporation to approve, or rather to cover postpartum family planning, postpartum IUD. And so therefore now, postpartum family planning, postpartum IUD services will be reimbursed by the PHIC, or Philippine Health Insurance Corporation. It's the government insurance system that we have here in the Philippines. We also have advocated for the DOH to allocate funds for the needs for postpartum family planning, postpartum IUD, and they in fact have allocated funds now for an initial 1,000 kits for postpartum family planning, postpartum IUD service provision in government hospitals. Now, for the current of potential challenges, the foremost challenge is there's still inadequate attention to the potential of providing family planning services postpartum. There's still a need to disseminate the information about the importance of postpartum family planning. The challenge number 2 is a lot of missed opportunities to provide family planning information, counseling, and services. And hopefully all these challenges will be addressed by the DOH Administrative Order on Postpartum Family Planning. Challenge number 3 is our data. Our data are not systematically and regularly collected in some centers. And for hospitals, since hospitals are not reporting units of the government, we are just now beginning to actually enforce data collection and reporting in all these non-reporting units. For our future plans, of course, that's the next slide, please. Future plans and opportunities. For our future plans, we hope, or we still are advocating, or rather we are hoping that the postpartum family planning administrative order on the postpartum family planning, postpartum family planning will be signed, will be approved by the Secretary of Health, so we can go ahead with the scale up of the program. And number 2 is to push for the piloting of the integration of family planning and EPI, or extended program on immunization, and hopefully we can do that by early next year. For activity number 3, future plan is we're trying now to track postpartum family planning services in hospitals, and this is only in Visayas now, and this is facilitated by the program for young parents. And USA will do 2 things. USAID, the project, will do 2 things. One is they will strengthen referral linkages between primary health care facilities and communities and hospitals to ensure that there is a quality family planning counseling before and after birth. And also, of course, to ensure that quality family planning service provision is given. So now, the second initiative will be to harmonize MCH and FP20 systems. And this will be integrated into the service delivery networks, which the project is actually participating in. I mean, it's participating in this initiative of strengthening service delivery networks. I think that's the end of my presentation, and thank you very much for listening.
Thank you, Dr. Bernabé, and we really appreciate that presentation. And it's great to have two different countries, one from Sub-Saharan Africa and one from Asia. So we are going to, before I pass it around to Elaine, I want to encourage everyone to be posing their questions in the Q&A chat box so we can respond to them. And let me turn it over to Elaine right now to update us on the exciting session in January. Elaine?
Thanks, Monica. Good morning, good afternoon, good evening, everyone. We're very excited that we'll be able to see all of you in Nusa Dua in late January at the ICFP conference. I wanted to update you on the follow-up of since our Chiang-Mai meeting. That will be on Monday, January 25th. Shortly before the opening ceremony for the ICFP conference, starting from 8:30 a.m. to 2 p.m. at the Westin Resort in Nusa Dua, Indonesia. And the main purpose of this follow-up workshop is really to keep up with the rolling thunder of the energy and the enthusiasm generated from you all, the 16 countries, to accelerating scale of postpartum family planning. And our objectives are really to highlight progress that made at the country level and relevant global movements since Chiang-Mai, to revisit and then to share the progress made, and also to encourage country participants to discuss and exchange lessons learned at the policy, programmatic, and technical levels. And we also wanted to follow up on the ideas that generated during the Reimagine Postpartum Family Planning and really look ahead, what has happened since 7 months ago in Chiang Mai and how we should be shaping up this global movement in the next couple of years. So we will have a very exciting agenda. Every country from the 16 countries will have the opportunity to stand on the stage and present on your progress made. And then countries will also have some delicate time to engage in deep discussions and sharing your lessons learned in the detailed topics such as community-based strategies or advocacy, issues that you face or challenges you face around measurement, quality. So this will be a really opportunity sort of to look at the country accomplishments at a higher level, but also opportunity for you all to be engaged in the deep conversations about your lessons learned and sharing your experience. So we really wanted to encourage you and your country colleagues who is participating at ICFP to be present at this follow-up workshop. And please do share your invitation to others from your country team who may or may not be aware of this follow-up meeting. You all by now should have received an invitation, and then there will be a direct link after this webinar in the follow-up email allowing you to share the invitation with others. And of course, if you have any questions or any specific comments for this workshop, please do let us know. In the coming weeks, we'll be able to send you the agenda for you to review and also anticipate what's coming next. So thank you very much.
Thank you, Elaine. And as Elaine noted, we're really looking forward to the country's feedback on the session. So please feel free to be emailing us and be actively engaged in designing this. And I think it will be a really exciting session before we kick off the ICFP. So let me turn this over to Ann Fitzer now. And Ann, how are things in Cotonou? And do you have any? I'm checking on the questions. I see one for Deepo, but let us know is happening in Francophone Africa.
Great, thanks, Monica. Yes, this is Ann Fitzer. I'm the family planning team leader for the Maternal and Child Survival Program, as you will recall from meeting me in Chiang Mai. And we do have some questions being typed in the chat box. I think other participants, we invite you to continue to add those there. From Kutnu, I think we're just getting ready for the Ouagadougou Partnership annual meeting, the 4th annual meeting of 9 countries in West Africa that are working with donors to advance and accelerate progress towards universal access to family planning. So the meeting hasn't started. It starts tomorrow. I'll have more to share at maybe a future meeting. But for now, let me turn to 2 questions, one each for Nigeria and for the Philippines from Mary Jane Lacoste. So for Nigeria, it says, can Prof. Jhpiego please elaborate a bit on what PPFP indicators are being considered for inclusion in the Nigeria HMIS? And maybe we'll start with that. So Jhpiego, go ahead.
Okay, this is Jhpiego. First of all, I'd like to say that this is a work in progress. The stakeholders have not met to decide on the specific indicators, but a few suggestions have been raised. For example, number of women counseled in the immediate postpartum period for postpartum family planning, number of women who received a postpartum family planning method immediately after childbirth, disaggregated by the method. Those are just 2 examples that I have, but as I said, it's a work in progress. There is no indicator currently in the HMIS that tracks anything postpartum family planning. All the family planning indicators are for interval.
Right, great. Thank you, Jhpiego. And then for Dr. Abe, the question also from Mary Jane Lacoste of the Gates Foundation is to please comment on how the current TRO is impacting postpartum family planning efforts at the present time, if at all. Dr. Abe?
Actually, we're planning to is to, hello, yes, can you hear me? Hello?
We can hear you.
Yes, go ahead.
Okay, now, yes, one of the things that we actually plan to do after after the new medical eligibility criteria came out from the WHO was to integrate the implant in the postpartum family planning program. And it was actually being started already in some centers in the Philippines. But then again, the TRO came out from the Supreme Court of the Philippines, and this effectively curtailed the implementation or the inclusion of implants in the service delivery system of the government. We still have the private providers providing implant services, but these are actually not on a massive scale yet. The DOH, the Department of Health, actually is engaging the CSOs, the civil society organizations, to push. I shouldn't say this. This is a TRO, right? Well, no. Anyway, to push the program, the implant program in the Philippines, because the government now is actually prevented from implementing, or rather from giving implant services. That's what it is now. The TRO is under review. We have actually submitted our answer. The government has submitted its answer to the TRO, and the Supreme Court is now reviewing the answer of the government. So that's why it stands now.
Okay, thank you. Mary Jane, I hope that answered your two questions. I'm going to turn over now to Jenny Gilbertson who has a question for Nigeria, which I think those of you on the web format can read, but it's a two-part question about whether the training of healthcare workers is targeting certain areas, states of Nigeria, or are they being trained in multiple states? And whether Jhpiego is leading this training effort or is there collaboration with other partners? So Deepo, can I turn it over to you?
Thank you very much. Well, different partners are doing training, but I can only talk about the trainings being done by Jhpiego. We are working in two states, Kogi State, which is just south of the Federal Capital Territory, and Ebonyi State, which is in the southeast of Nigeria. So that's where we are training trainers at this time. But Mary Stokes, Society for Family Health, have also done some training in other parts of the country. So we are trying to get the Federal Ministry of Health to kind of coordinate all of these and map out who is doing what and where, so that we will know where gaps are as we begin to expand. Mind you, this is just very, very early on with PPIUD in Nigeria. It will take time for the early adopters to really have a significant impact. But we've started.
Great, thanks, Deepo. I see that there's also a question from Trish McDonald of USAID Washington for the Philippines. Dr. Abe, the question is whether you've already identified what indicator you will use to capture postpartum family planning and immunization integration or uptake.
Say that again, please, and I didn't hear it.
Yeah, sorry. It's about the family planning and immunization integration, and whether you have already defined an indicator to measure uptake of family planning within either the immunization or well child visit or through a referral from the well child. I assume that's what the question is. From whether there's a referral to a family planning unit, and therefore you can then track that referral in the family planning unit. Is there a way that you've decided to measure what contribution that integration is giving your program?
You know, I don't know the answer to that question. I have not seen the guidelines. What I'm going to do is, if you can email me that question, and I'll actually pass it. I'll pass it to Dr. Kusin, and you will receive your answer by email. I'm sorry I can't answer that question. I'm not familiar with the guidelines right now.
Right. Okay. I think that's fine. We'll email you the question, and we can perhaps also email you some other ideas and thoughts about how to do that. It's not a simple process from our experience. While I see that folks are typing away, and maybe my connection is not so strong, so I'm not seeing the questions yet. In the meantime, I'm going to take advantage and ask both of you again, what do you think is the most, what inputs are needed now, or what is the most important thing that could help advance your PPFP action plans today? So maybe starting with Nigeria, Deepo.
Thank you very much. With the initiation of our training for postpartum IUD, one thing that came out clearly was the need to have dedicated counselors for postpartum family planning. This was the experience shared with us by our consultant who came from India, that they have similar challenges at the beginning because women were not being properly counseled because the midwives were busy delivering babies and so on. So we think that this is an area we like to explore, whether or not we hire retired midwives or some community health extension workers, or whether we train volunteers to do this. We certainly think that we need dedicated counselors to advance the issue of postpartum family planning. The other thing, of course, is periodically we do run out of family planning commodities. We are assisted by our donors, but the government also made some commitments which we have not been able to fulfill. So occasionally we do have shortfalls in procurement of family planning commodities. This is an issue that needs to be solved. We need to have the products there all the time when needed, so that when we do the counseling, the clients will be able to receive the method of their choice. The other thing is to increase access. We think that something we'd like to try is to take the services to where the people are. Right now, we expect women to come to the family planning clinic or to come to the hospital. Whereas if we establish family planning clinics in the market, for example, or very close to the market where women go on a daily basis, we think that it provides an opportunity for them to combine going to the market with seeking and obtaining a family planning method of their choice. These are some ideas that we are toying with, and as the time comes, we will try and see if we can come up with some concept note and seek support to try these ideas out.
Great. Thank you, Jhpiego. Dr. Abe, how about for you? What is the most important thing that would really advance your PPFP action plan at this time?
What is the most important thing that we have done? Crafting the administrative order, which actually
sorry.
Some interest for mental health. The most important thing that we have done.
No, not that you have done, sorry, but that you need.
That we need to do. Is that what you're asking?
Yes. That would help right now advance the plan to move it forward.
Say that again, Anne, please.
Sorry, the most important thing that would help advance your plan right now, that would sort of help accelerate progress. Does that come through?
The most important thing. The most important thing that needs to be done for the postpartum family planning to really scale up in the Philippines is for that administrative order to be signed. That will give actually the mandate to all the government hospitals to implement postpartum family planning. So that's what we are actually hoping for, that the administrative order on postpartum family planning will be approved and signed by the Secretary of Health of the Department.
Great. That's helpful. There's actually an additional... Yes, I think you did. You said the administrative order is really capital to really advance things at scale in the context of the Philippines. And there's a follow-up question from Dr. Moriam Jagun for you that says that you mentioned inadequate attention to the potential of providing FP services in the postpartum. And she was asking you to clarify from which group is this inadequate attention? Is it from the government or is it from somewhere else? And what are you doing to overcome this challenge?
Both, actually. Both in the government and in the private sector, there's really inadequate attention to postpartum family planning. The postpartum family planning actually came into the radar only when NCHIP came in the Philippines. That was the program that I actually got involved in, and
or you could say led.
Establish all the centers of excellence that provide service delivery and training and technical assistance to those interested in the provision of postpartum family planning, postpartum IUD. But we are still in the process of expanding the reach of the centers of excellence on postpartum family planning, postpartum IUD. All right. We are getting some interest now, but like, for example, the private sector, those midwives who have lying news, they're becoming more and more aware that there is such a thing as postpartum family planning, postpartum IUD. Eventually, we'll of course include the implants. Okay, but then for now, let me just talk about postpartum IUD. There's becoming the interest on postpartum family planning. I think is gaining interest, but not enough to go nationwide. To really scale up to the extent that all of government hospitals or all government facilities will be offering it. Not to the extent yet. And in the private sector, it's the cost of the training. That's one of the things that they're actually complaining about. That it's probably some midwives cannot afford it or something like that. This is in the private sector. Because in the government sector, it's free. Did I answer your question? That's how I view it. There's still not a lot of dissemination, I suppose, as to the importance and to the value of postpartum family planning. Hello.
Dr. Abe, this is Monica, and yes, we heard you really well. I don't know if we lost An from Cotonou or not. An, are you still on? Well, I do see a question. Dr. Abe, can you hear us?
Yes.
Great. Thank you for answering that question. I think we're just trying to check and see if An is still on the phone, and if not, I see a question that Mary Jane has for Dr. Jhpiego regarding post-abortion care and whether that's part of the national program here. Dr. Jhpiego?
Thank you very much. Yes, post-abortion care is part of Nigeria's reproductive health programming. Even though abortion is restricted here, but we do provide post-abortion care, and that is inclusive of post-abortion family planning. So these methods can be provided. We have no restriction for that. The other question is in respect of whether we are planning to apply for the GFF funding opportunity. Yes, this is a work in progress. I have to discuss with Elaine some of our thoughts, and we hope that perhaps we can find a way to seek support for testing the important role of dedicated counselors to lead to increased acceptance of postpartum IUD and postpartum implants. So this is something we are thinking about, and we have to discuss in-house and with headquarters.
And Mary Jane, just so you know, with the annual meeting, the national stakeholders meeting here on Thursday and Friday, I think this issue will be brought up. So thank you for your question. Anna or Elaine, back to you for other questions.
So thanks, Monica. And Dr. Abe, there's also a similar question for you, is that in the Philippines, do the National Postpartum Family Planning Program also incorporate postpartum care, or is it being seen as a separate program?
Again, please.
Dr. Abe, can you hear me?
Yes, now I can hear you.
Okay, so this is a similar question for you in the Philippines. In the National Postpartum Family Planning Programs, are you also incorporating post-abortion care, or is this a separate program? And do you see any challenges in including postpartum and post-abortion family planning?
Right, okay. That's a very timely question, actually, because I'm right now, I'm the head of a TWG reviewing our PMAC program. The PMAC program is separate from the postpartum family planning program, by the way. So I'm reviewing the PMAC program. We have member TWG on that, and I'll approach you all about progress in the conference, in the IPFP.
Okay, thank you. And okay, do we have more questions from the participants? I think, we're I guess one question I would like to ask Dr. Jhpiego and Dr. Abe is in Nigeria, when you talk about postpartum family planning in your action plan and to other stakeholders and also disseminate the updated medical eligibility criteria, and do you want to is there any particular challenges in terms of disseminating MAC, or do you have any tips and insights that you want to share with all for other countries to support this movement?
Thank you, Elaine. Well, actually, the initial challenge we had was that we didn't have enough of the will, the new 2015 will. But WHO was able to supply us a number, and we were therefore able to share the new 2015 MEC wills with our trainees. Previously, we had some of the older wills, but then we didn't want them to get confused, so we decided to go to WHO for assistance. We have since imported some from WHO in Geneva, so we do have enough new MEC wills now for our training. That was the challenge. Of course, once all the materials have been updated to include new information from WHO, it will be important for us to get that new information to service providers. And of course, for new service providers who will be undergoing training, there will be no problem because they will be trained with new information. But for the older ones, we think that as we do supportive supervision, we would share the new wills, we will tell them what's new, and we'll probably develop a set of new IEC materials which also help to get the message across that you can actually insert an IUD immediately after childbirth, or you can insert an implant immediately after childbirth. So we're looking at all these options.
Thank you, Jhpiego. And Dr. Abe, how about in the Philippines?
I want to talk about family planning, postpartum family planning with stakeholders. Of course, we emphasize the perspective on medicine in the postpartum, which is really 50% or close to 50%. And we also emphasize the WHO recommendation for healthy birth to spacing, healthy birth to pregnancy interval and all that. The challenge that we get is actually in the integration of postpartum family planning in the spectrum of maternal care and child care. You see, we have very, very limited manpower in integrating this initiative or this program into the current program, into the maternal care program and child care program would be an added burden to the current providers. Now, we're having some successes actually, but you see, we still have to broaden or to increase the number of people who are doing this, integrating postpartum family planning into the spectrum of maternal and child care. That's where I think the challenge is.
Great. Thank you so much, Dr. Abe. With this, I would like to go ahead and close the session. And thank you so much for all of you sort of sticking with us in this very last webinar before we meet again in Nusa Dua at SCIFP. And then I wanted to particularly thank the country teams in Nigeria and the Philippines. I think today's webinar really given sort of example and really we're very happy to see the progress you all made in the at the policy level and really sort of moving on to the implementation and in Nigeria focusing on the day of birth and in the Philippines and sort of looking into family planning and immunization integration. I think this is just really give us a flavor of how, you know, countries are really taking on your postpartum family planning action plan. And thank you all, particularly Dr. Otoloran and Dr. Abe, and speaking on behalf of the two country teams, and I know you all are working very hard. And then just a reminder that we'll be sending out the short survey and the follow-up email in our thank you email for the webinar. Please do complete a survey and also share the link about the ICFP workshop on January 25th with your colleagues. And again, like Monica said, if you have any questions and want to give us any feedback, please feel free to reach out to us at any time. This webinar session is being recorded, so you'll have the chance to go back and if you want to listen or share with your colleagues. Again, we thank you so much for your time and the participating from near and afar. Thank you.
Thank you, Elaine.
Thank you. Bye-bye.
Bye. Thank you.